Welcome to the module on assessing patients' healthcare skills. This module describes the importance and benefits of completing healthcare skills assessments for youth and adolescents approaching transition, as well as for caregivers of patients unlikely to achieve healthcare independence. It provides tools and strategies to implement transition assessments in your practice. Finally, it provides quality improvement strategies and ideas to apply in plan, do, study, act cycles. Young adults need self-management skills to maintain good health. In the adult healthcare environment, providers expect patients to manage their own healthcare. Transition-aged youth may lack the skills, knowledge, and confidence required to take charge of their care. Youth with special healthcare needs and/or their caregivers may need additional preparation to operate in the adult healthcare setting. Healthcare skills assessments help physicians, youth, and families identify strengths and weaknesses to address prior to transition. By teaching youth and teens the skills to manage their own healthcare to the fullest extent possible, they gain more control over their lives and achieve a higher degree of independence. Here are the skill areas you can assess to determine if the teen will be able to take care of their own healthcare when he or she becomes an adult. The first skill area, accessing healthcare, addresses the treatment or prevention of illness. This includes such skills as making doctor's appointments, knowing when and how to call 911, or when to go to the emergency department. In later adolescence, it includes skills such as keeping an updated portable medical summary or care plan. The second skill area, managing conditions and treatments, examines the teen's management of his or her own condition, empowering teens to take charge of their healthcare and bodies. This area includes skills such as knowing when to call the primary care doctor versus the specialist, describing diagnoses, giving a history of illness to a healthcare provider, and listing medications with dosages. Older adolescents without special needs should be able to take all medicines correctly on their own, fill their own prescriptions, and care for their own medical equipment and supplies. Older adolescents with intellectual or significant physical challenges may need training to attain these healthcare skills when possible. The third skill area involves staying healthy. Does the teen recognize and follow preventative practices? This includes such skills as knowing which foods to eat and avoid, exercising, avoiding illness triggers, and recognizing how lifestyle decisions affect a condition. The fourth skill area focuses on using health insurance. It emerges in later adolescence and includes creating a plan with some assistance to obtain the type of insurance necessary and determining what that insurance will or will not cover. It is also important to understand copays and how to maximize benefits. Finally, other key areas that factor into the health of the transitioning teen and require planning include housing, employment, finances, and in some cases, guardianship. A good way to begin addressing these health skill areas is to identify strengths and weaknesses with the adolescent. Here is a project-developed example transition checklist for teens. The Youth and Family Work Group for the project culled questions from various assessments and compiled the best questions into one tool. The checklist is divided into the same 5 skill areas just discussed: accessing healthcare, managing conditions and treatments, staying healthy, using insurance, and other areas of transition. It is color-coded to show which skills to focus on in early, middle, and late adolescence. The checklist helps adolescents and the physician-led care team 1. Evaluate the adolescent's current skill levels. 2. Identify areas for improvement. 3. Determine areas requiring education and practice prior to transition. And 4. Areas in which the patient may need continued support as an adult. Use the link provided to view or print the checklist. We included it under the Tools tab for easy reference now or after the training. Some youth with special healthcare needs may not achieve healthcare independence due to intellectual or developmental disabilities. The caregivers of these patients need to prepare for the transition to the adult medical system. Here is a transition checklist for parents and caregivers, divided into the same 5 skill areas just presented and designed to complement the transition checklist for teens. This checklist helps caregivers and physicians 1. Determine the healthcare tasks the teen completes on his own versus those tasks the caregiver currently performs. 2. Identify skills the patient can learn. And 3. Identify areas in which the caregiver needs additional education, practice, or support. Again, use the link provided to view or print the caregiver checklist. We included a copy under the Tools tab. In a busy practice, going through another checklist adds time to a visit that may already be filled with counseling topics. Here are 5 practical strategies for completing the checklists. Some may be more feasible than others based on your patient population and office resources. 1. Give the teenagers or caregivers the checklist to complete in the waiting room prior to their appointment. 2. Send the checklist home for families to complete, either at the prior appointment for the family to bring back, or through the mail, so that the teen will complete it before the next appointment. 3. For families with low literacy levels, who have difficulty with English, or are overwhelmed by the task, arrange for a nurse or care coordinator to help the individual complete the checklist, either in the office or over the phone. Think outside the box if resources are limited. For example, you might identify a parent of an adult child with special needs who went through this process and offer her or him a small part-time job. Their experience and empathy would be invaluable in guiding other parents through this process. 4. Some practices utilize websites and the internet more than others. Making the checklist available online could improve completion rates. 5. The final strategy is to arrange a special visit for transition planning to complete and discuss the checklist. Refer to the coding and reimbursement module for tips on payment for this type of visit. Once the checklists are completed, incorporate them into the visit. Here are some strategies for discussing assessment results. Foster open communication and build trust by recognizing and accepting feelings that accompany skill deficits. Reserve judgment about the adolescent and family personal behaviors. Assess the youth's and/or caregiver's ability to perform the skills they report. For example, ask the youth questions about his or her condition and medications to confirm that you correctly conveyed the information. If you need additional information, use an open-ended assessment tool such as "How well do you know your healthcare needs?" to supplement the checklist. During the visit, weave anticipatory guidance and discussion of healthcare skills into the normal flow of the history and physical, using teachable moments. This will save time and highlight the importance of these skills to the teen. Finally, help the patient and family prioritize areas of concern in the checklists. Do not feel like you have to do it all in one visit. Turn the discussion into an ongoing conversation and make action points for the next visit. For appropriate follow-up, document the discussion so you do not reinvent the wheel at each visit. Keep a copy of the completed checklist in the patient's medical record and provide a copy to the families so they can prepare for the next visit. Use the checklist on subsequent visits to check progress, update goals, and build skills. Skill building is an ongoing process. To help teens build sustainable healthcare skills, 1. Incorporate education and skill building into the transition plan for the teenager. 2. Practice the healthcare skills at every visit. Address the teenager when taking the history and going over medications. Highlight areas in which the teenager still needs practice. 3. Give youth and their families written skill sheets for at-home practice, a prescription to build healthcare skills. 4. If patients already have an individualized education plan or transition plan in place, then help families incorporate skills that need more work into these plans. 5. Finally, be sure to reassess progress periodically during the years prior to transition, as discussed next. Reassessment is a key element of the healthcare skills assessment. It is important to measure progress by using the same tools at periodic intervals. Use the transition checklist for teens or other tool every 1 to 2 years, depending on the frequency of returns. For caregivers of teens with intellectual disabilities, complete the complementary transition checklist for parents and caregivers as needed. Review the patient's progress. Recognize success and remember the power of praise. This helps motivate teens to take responsibility for their own health and independence. Document results each time you review the assessment and update the transition plan to reflect the teen's progress. Next, we discuss quality improvement for this key clinical activity. The aim for this KCA is to use the transition checklist for teens and the transition checklist for parents and caregivers as needed to assess the healthcare skills of youth ages 14 and older every 12 to 24 months. Be aware that the AAP recommends an annual assessment for youth approaching transition. This project's extended timeframe helps account for visit noncompliance. You can collect data and measure this KCA via the chart review question. Have the patient's healthcare skills been assessed using the recommended tools within the past 12 to 24 months? Anytime a new initiative is suggested, barriers to improvement and change arise. This excerpt from the Barriers and Ideas for Change grid lists several different scenarios that include challenges as well as improvement ideas for addressing them. Refer to your printed copy of the grid as you work through PDSA cycles. Test ideas you and your team think are likely to succeed and will bridge any gaps you identify. Here are some resources for assessing the healthcare skills of patients and caregivers. Listed first are some project-developed and other transition tools. Many of the project-developed tools are available in English and Spanish. Here are some informative websites related to assessing healthcare skills. They are available in the Tools tab for future reference.